Good evening, colleagues. Good evening and welcome to tonight's masterclass. My name is Raisibe Madure. I am a manager in the CPD and registration unit. And today I'm going to be taking us through the Continuous Professional Development Virtual Masterclass. Thank you very much for joining us. We do not take it lightly. We really appreciate your presence and we hope that you will leave here much more empowered. In this class, we will address the CPD requirements. This is where we will talk about the annual declaration and when it's supposed to be done, designation of persons, what does designation mean and how do you designate yourself, CPD essentials, which includes the Competency Standards. These were published by Council for Implementation in 2018. In it has got the domains and competencies, and we will also address the frequently asked questions and the facts. So some of these frequently asked questions is what we acquired from the questions that some of you asked when you enrolled yourself for this masterclass. And some of them is the questions that we receive on a day-to-day basis, but we have selected those that are more aligned with tonight's class. How to learn. Under what to learn, we will go through what constitute a good CPD activity, what learning activities can I use as my CPD entries, what kind of evidence can I use and what should I do with my evidence. We will also go through compliance and archives. And lastly, we will do the highlights and we will open the session, questions and suggestions. So what are CPD requirements? What is required of me as a pharmacist? What does council expect from me with regard to compliance to CPD? So council requires of each and every pharmacist to, by the 1st of February of each year, that was published in 2018. They are also in the CPD guidance document. If you would like to also read all the requirements and everything that has to do with CPD, you will also find them in the CPD guidance document. So you go through those, and if you have decided that you still want to be a practicing pharmacist, when you go through this annual declaration, you will choose the options that will say, I do this some of the time, or I do it most of the time. But if for all your competency standards you have chosen, I never do this, you will then be designated as a non-practicing pharmacist. So if you are still a practicing pharmacist, please make sure that you check the competency standards and choose those that do apply to you or apply to what you are interested in, or it's a preparation for future. And once you have designated yourself as a practicing pharmacist, you are then required to complete 6 CPD activities for the year. So every year that you designate yourself as a practicing pharmacist, you need to, by the 31st of December of that year, then complete 6 CPD activities. For 2020, the CPD activities were supposed to have all been completed by the 31st of December of 2020, but council has given those that could not comply with their CPD requirements up until the 30th of April of each year. For 2021, it's the 30th of April of 2021. So by the 1st of May, if you still did not comply with the 2020 requirements, we will then mark you as a non-practicing pharmacist. In the next slide, we will explain what all these designations mean. And then also, as part of your requirements, you are expected to maintain an electronic portfolio. Please do not upload your portfolio of evidence on the CPD system. We do not require of you to upload the evidence. You can keep it as an electronic portfolio just in case council requires, or you get called to say, can we please get evidence for this particular CPD activity? That is the only time you can then send it through to us. So as I've explained, the annual declaration is based on the competency standards for pharmacists, which were approved by council in February of 2020 and published for implementation in 2020. And these competency standards do have the domains, which explain what is expected of you, and the competency standards, as well as the behavioral statements. We will go into details on the upcoming slides. And the results of that will be either you are a practicing pharmacist or a non-practicing pharmacist. And if for some reason you did not complete your annual declaration by the 1st of February, council will auto-designate you as a practicing pharmacist. And as a result, you will be required to comply with the CPD requirements until such time that you then declare yourself otherwise. So if you want to declare yourself as non-practicing, please do that by the 1st of February. Because if you do not, and perhaps, for example, you wait until July, you will then be expected to comply with the prorata of your CPD requirements for that year. And how the prorata works is, if we say 6 CPD activities per year, we then mean 1 CPD activity per month. Sorry, per every 2 months. So if 2 months lapses and you did not designate yourself, then you all cancel 1 CPD activity. And if it's 4 months, then it's 2. So if you then decide to designate yourself as non-practicing on the 4th month of the year, you will then need to comply with 2 CPD activities. You will need to complete 2 CPD activities. The designations are explained in details in the regulations relating to continuous professional development. And this is where a registered pharmacist then chooses to designate themselves as either practicing, which means that they are providing one or more of the services or acts pertaining to the scope of practice of a pharmacist. And I'm purposefully saying a pharmacist for now because the pharmacist assistants, the pharmacist support personnel are not mandated to comply with the CPD requirements at the moment. Maybe let me explain that whilst we're still here. So they will only be expected to comply with those requirements the moment that council had released a board notice to say that pharmacy support personnel is now mandated to do so. At the moment, council is still drafting the competency standards related to the practice of pharmacy support personnel. It is at a stage where it will soon be released for comment. Please be on the lookout for that and make sure that you comment. Once your comments comes back to council, council will review the comments and then amend the document and publish it for implementation. After that, that will only be when council will then publish a board notice that will then mandate the assistants and the technicians to comply with the CPD requirements. So a practicing person, as I've said, is someone who is performing one or more of the acts pertaining to the scope of practice of a pharmacist, and this person will then be required to comply with the CPD requirements. A non-practicing pharmacist is then a person who is currently not providing any of the services, any of the acts pertaining to the scope of practice of a pharmacist. And as a result, this person cannot be found performing any of the services. They cannot be found in a pharmacy. But they will still be a registered pharmacist and they will still pay their annual fees. So on this slide here, we're going to take just one moment to familiarize ourselves with the competency framework. And the competency framework is made up of the domain, competency standards, and behavioral statements. So please take a note of how your competency standards are structured and please familiarize yourself with them. And that way you will then be able to know which ones apply to you, to the acts that you are practicing at the moment, and which one applies to the acts that you're interested in, and which one do you want to familiarize yourself with in preparation for your future career. So we do have the domain, which then has an introduction. And in the introduction, it then explains to you, if we say that a pharmacist is competent in this particular domain, then what do we mean? And it has got the competencies, which have behavioral statements. And the behavioral statements are divided into entry level, intermediate level, and advanced level. And these levels, please note that they do not apply to the number of years that you have been registered as a pharmacist or the number of years that you have been working as a pharmacist. They apply to the level of practice pertaining that particular scope of practice or that particular competency standard. How familiar are you with that particular competency standard? For how long have you been performing it? So if you are new in that field, you will then choose entry level. But if you've been there for a while and you're familiar with it, you can then choose intermediate. But if it's a competency that you are advanced at, that you have been performing for a long while and have more experience in it, you will then choose the advanced practice. So the competency standards have 6 domains, which are the public health domain, safe and rational use of medicines and medical devices, supply of medicines and medical devices, organizational and management skills, professional and personal practice, education, critical analysis, and research. And please, I urge you to familiarize yourself with this. It's very important in order for you to understand what is then expected of you. Because we have received a lot of queries where people are saying CPD does not apply to me because I don't work with patients. But we are saying that these domains cover the scope of practice of a pharmacist in all the sectors of pharmacy. So we're just going to go through one domain here, which is the public domain. And this domain applies to all the pharmacists whose practice includes promotion of health and wellness through the provision of healthcare information and education to the public and other members of the healthcare team. And this domain does have 6 competencies, which are promotion of health and wellness, medicines information. This is where you provide medicine information or you do draft the medicine information. Professional and health advocacy, health economics, epidemic and disaster management, and primary health care. And we have, for the purposes of this presentation, chosen the behavioral statements of the entry level. And those are provide advice on health promotion. This is where you go out and you provide advice, or you provide advice on disease prevention and control, or provide advice on healthy lifestyle, provide advice in public health campaigns. And the other behavioral statements, because they are more advanced, they have different behaviors, and some of those behaviors are draft policies, approve the policies. So it depends on the level at which you are in that particular domain for the moment. So I'm going to take this opportunity to take us through the 4 most frequently asked questions, wherein we get people that are saying that they strongly feel that they should not be mandated to comply with the CPD requirements because they do not provide direct clinical care. They don't see patients at all. So we will get a person say, I only develop regulations. I'm a regulatory pharmacist. I never get to see patients. As a result, I should not be mandated to comply with the CPD requirements. Or I'm a pharmacist. I never get to see patients. I'm doing other things such as research. I research drug interactions and drug usage, but I never get to see patients. Or I train pharmacists. I train pharmacy support personnel. I train B-Pharm students. And as a result, I should not be compelled to comply with the CPD requirements. But our answer is then simple. Pharmacy practice is not restricted to the provision of direct clinical care only. It includes working in a direct non-clinical relationship with the clients, working in management, administration, education, research, advisory, regulatory, or policy development. So as a result, we are saying to all those questions that you are a practicing pharmacist and you are then mandated to comply with the CPD requirements. Your only obligation is then to familiarize yourself with the CPD requirements and then select those that are relevant to your scope of practice and those that are of interest to you, can either be for personal development or for future career development. And then how do I learn? If I read something as a perceived as a CPD activity, if I speak to a colleague about something that I do not understand and I get clarity, did I learn something? Can I use that as a CPD activity? If I was watching TV and they were discussing things that are pertaining the scope of practice of a pharmacist, and it's something that I am curious at and I actually learned something from that, can I then use that as a CPD activity? Yes, you can use that as a CPD activity. But first, let's go through the definition of continuous professional development, and then after that, we will do the different types of learning activities. So CPD is the process by which registered persons maintain and enhance their competence throughout their professional careers. So it is also one of the objectives of the 8-star pharmacist that we should be lifelong learners. So it is very important that we make sure that we learn in order for us to serve better, in order for us to then uplift the dignity of the profession, in order for us to stay abreast with all new information that is happening in our practice or the practice of a pharmacist. So CPD enables registered persons to develop their area of practice and demonstrate competence. And we will all agree that it's a lot of things that during our study times, they were not covered. They were not happening in those days. A good example is COVID-19. We all never thought that we will go through this. And as a result, we never learned about that when we were doing our B-Pharm. And it is here, it is happening. It's something that we need to then familiarize ourselves with, how to prevent, how to treat, how to inoculate. So it's things that we find ourselves needing to learn. The submission process. You need to submit 6 CPD entries, and please, please, please do not upload your evidence on the CPD system. You can keep it in an electronic file in case council requests that of you, but please do not upload it. It's not mandatory for pharmacists to upload the evidence. There are 2 different cycles for you to pick from when you upload your CPD activities. And we have had a few misunderstandings where people started with the 2-step cycle and did 3 entries. And when they wanted to do more, it then did not allow them and they did not understand what was happening. So there is a 4-step cycle, which is a cycle that has been there since the inception of CPD by council. Most tutors and RPs, I'm sure, are familiar with this cycle. And this cycle does not have any limitations whatsoever. You can enter however many activities for a year that you can afford time to do. It does not limit you. It requires prior planning and outline, and it only allows for submission once you have completed all the steps. You can start the cycle at any step, but it will not allow you to submit until you have completed all the steps. And what we mean by there's no limitation is that you can enter more than 6 CPD activities using this 4-step cycle, but there is no carry forward in CPD. So your CPD activities cannot be carried over to the subsequent years. They only apply for that particular year that you have entered them in, or if you did not comply with your CPD requirements by the 30th of April and you complete CPD activities before then they will count towards the previous year. For example, now we in 2021, but for those that do not yet comply with the 2020 requirements, you still have 10 days to go. You can still enter your 6 CPD activities, or you can even enter more. Then we will take 6 and count those towards 2020, and the rest will be counted towards 2021. But if you do enter 30 now before the 30th of April, we will take 6 and count those towards 2020. The 24 that's left will all be counted for 2021, but we will not take the other ones and count them for 2022. So the 2-step cycle is limited to 3 activities per year. So once you enter 3 activities with this step, it then closes up and writes for you in red that you have reached your maximum for the year and does not allow you any more entries. You can do further entries using the 4th step. It is an instant activity wherein you sitting in a seminar like this masterclass and you realize that you have actually learned something that you wanted to learn and you want to use that as your CPD activity, you can do so. Or you have enrolled yourself for a course hoping to learn a particular thing, but when you are in the middle of that course, you notice I've learned something extra, then you can use that as your CPD activity. It follows no thought process as compared to the 4-step cycle wherein you need to ask yourself, what is it that I need to learn? How am I going to learn? And after I have learned, what am I going to do with the information that I have learned? So with the 2-step CPD activity, you only do the evaluation and the implementation. So this is where you find yourself having learned something already, and then you ask yourself, okay, I've learned 1, 2, 3. What am I going to do with this information? How am I going to apply it in my day-to-day work? So what constitutes a good CPD activity? What is it that I need to know in order for me to then know that the CPD activity that I've entered is a good one? Your CPD activity needs to have a learning title, and please make sure that your learning title is appropriate and it's relevant to the domain that you have chosen. And it should not just be a copy and paste of the domain or the competency or the behavioral statement. It should be something that you craft yourself with using your own understanding and make sure that it applies to the domain. It should have a learning need wherein you are addressing the knowledge gaps, the skills gaps that you have. So here you can ask yourself, what knowledge gaps do I seek to fill? What is it that I feel that I need to know? It should have a learning method or a learning activity. And these learning activities are divided into measurable activities. And these ones are activities that it could be a course that you have registered but has a duration that is less than 6 months. It could be that you're preparing yourself to go give a speech. You can use that if you were invited, for example, to be a guest speaker and you needed to prepare and you learn things there. And there are non-measurable activities, which are then, if you read a journal, if you have attended a conference, if you have attended a masterclass like we are today, you can use that as your CPD activity. And the structured ones are courses that are more than 7 months in duration. And this could be postgraduate studies, could be your PCDT, it could be a diploma, it could be a master's, it could be any course that you see that is relevant to what you would like to learn. And you can use that. And we have received questions where people are asking, if I have enrolled myself for PCDT, for example, or I have enrolled myself for a master's, can I use my master's then to complete all my 6 CPD activities? And the answer is yes, because with from compared to interns, you are allowed to enter more than one CPD activity using the same domain as compared to interns who cannot do that. Or if the course you are doing addresses more than one domain, then by all means do so. Even if it addresses the one domain, but it's different learning titles, it's different things that you feel you have learned, it's different skills, then by all means use it to complete more than one entry. Your good CPD should have a learning outcome. The learning outcome is where you are addressing what is it that I have learned? How did it improve my skills? How did it fill in my knowledge gaps? So the learning activities is what I have just went through now. The non-measurable ones are the ones here, the self-study, case study, attending a conference, speaking to a colleague, seeking clarity, watching TV, reading an article. And the measurable ones are a short course that is less than 7 months in duration. If you were invited as a guest speaker, it's a measurable one. And the structured one are those courses that are more than 7 months in duration. Could be diploma, it could be another, it could be postgraduate studies. And so what is a portfolio of evidence? What kind of evidence do I need to keep, and what should my evidence look like? So your evidence must be current, meaning it should be for that current year. It should be valid and relevant for the domain that you have chosen. And please, please, please do not upload the evidence on the CPD system. CPD entry must relate to what you have learned in the current year. And as I have said, please do not upload your evidence on the CPD system. And your evidence can be any document that you have acquired in the learning process. It can be the article that you have read. It can be a certificate that you have acquired. It can be, if you were creating learning materials, it can be the learning material that you have developed. It can be the regulations you have developed. It can be the policies. It can be the standard operating procedures. It can be any document that you have developed relevant to what you were learning. So as I've said, for the current year, so for 2020, you cannot use evidence that you have acquired in 2019. And for 2021, you cannot use evidence that you have acquired in 2020. So please make sure that your evidence is current. Compliance and archives. So the CPD activities for pharmacists, as compared to those of interns, are not being assessed for competence. So Council did not assign any assessors to assess your CPD entries to check if you have done a good job, to mark you and give you marks. No, Council will not be doing that. So what Council is doing is checking that the CPD activities you have entered are relevant and that you have complied with your 6 CPD activities for the year. And that's all we check. And for those that already comply with the CPD requirements for 2020, if you go under annual declaration, you will see that it will show you here for the year 2020, when is it that you have completed your annual declaration. It will tell you if it's completed, yes or no. And then here, it will show you the total number of your CPD entries, and it will mark them as archived. We have archived your 2020 CPD entries upon compliance to make sure that they do not distract you, they do not disturb you when you complete your 2021 CPD and activities. Please, please do not go and restore these activities. Council does have them. We also do have this record, so it shows on our side how many you have completed for 2020, and we even know which date, and we know that they are archived. So please leave them there. And for those that will only comply with your CPD activities by the 30th of April using the grace period, what we will do is by then, 1 minute past 12 on the 1st of May, we will take your 6 CPD activities and archive them and mark you as compliant then for 2020. And whatever that is left will count towards 2021. So that we create way for you to then make sure that you comply with your 2021 requirements. So one of the most important highlights for the day is that Council's CPD system does not work on CPD points. This is hence we have said in the beginning of the presentation that no manual CPD activities are allowed. You need to go out there, learn, acquire the knowledge, and then come, log in on the system, and then reflect on what is it that you have learned. And also another highlight is that CPD activities for pharmacists will not be assessed for competence. There'll be no marks. There'll be no stories that you have failed or you are not competent, nothing like that. We only deal with compliance when it comes to pharmacists. Non-practicing persons should not be found performing the acts pertaining to the scope of practice of a pharmacist. So if you have designated yourself as non-practicing and you now feel that it's about time, there is a form on the website. So please fill in that form. We will reset your annual declaration. Then you can go and complete your annual declaration and designated yourself as a practicing pharmacist. No third-party entries are allowed. So it is breaking the code of conduct of a pharmacist if you give your login details to someone else in order for them to get access to your secure site of cancer. So please do not do that. It is a punishable offense, and the Professional Conduct Unit of Council is on the lookout for such behavior. And lastly, we do encourage lifelong learning, as this is what then empowers us to uplift the dignity of our profession. Council has launched the registration app. I'm sure some of you have already seen this app and installed it. If you have not yet done so, please do, because this app then allows you to have access to your digital registration card. And please note, Council will no longer be printing the physical registration cards. You will have access to your digital registration card anytime you want on the mobile application. Please make sure that you upload identity document size pictures of yourself that are clearly visible in order for you to use it as a digital registration card. You will also be able to, on this mobile application, amend your personal details. And you will also have access to the CPD system using this mobile app. So you can, at any point that's convenient to you, complete your CPD activities at your own convenience using your mobile application. So before I open the class for discussions and questions, I will try and go through some of the questions that we have received. We will go through them together and then I will answer that. And then after that, I'll open for discussions. So we have received a question that is asking, do we use the intern manual to complete CPD? And the answer is no. Pharmacists do have their own competency standards, and there is a CPD guidance document for pharmacists. So please use those. The CPD activities for pharmacists and those of interns are not the same. we're doing two different types of CPDs. Can I remain registered if I'm no longer practicing? Yes, you can remain registered. It's your choice, and designate yourself as non-practicing. Then wherever you want to go back and practice again, you can just apply to cancel for you to practice. If I am registered in July, do I still have to complete 6 CPD entries for the year? And the answer for this one is no. And it is the same answer if you had designated yourself as non-practicing in January, and in July you then change your practicing status to, your designation to now practicing. You will be required to then complete a prorata of the CPD entries. And as I've explained, that it's one CPD activity every 2 months. So if it's July to December, then it's 3 CPD activities that you will be required to complete. Must CPD relate specifically to pharmacy? I'm urging you to please familiarize yourself with the competency standards. They will be able to guide you in this regard. Can I capture my CPD entry in Word and then transfer it onto the website? We will not know actually that you have used Word. It is perhaps a good thing because you will be able to read your CPD entry, but this is all up to you, absolutely up to you. But please note that we do not accept manual entries. So you can't put it in Word and expect to then upload the Word document without you having to go through the required steps. If I develop policies, I provide training, can this be considered as CPD? This has been addressed, and yes, they will be considered as CPD. Is CPD compulsory for assistance? It's not compulsory. As I've said, that council is still drafting the competency standards for pharmacy support personnel. And then until such time that has been published for implementation, then assistants are not mandated to comply with the CPD requirements. What is the process to apply for extension or condonation of CPD requirements? What do I do if for some reason I am unable to comply with my CPD requirements for the year? If I am sick, or perhaps I'm on maternity leave, or I just took a break. So firstly, you have the option to mark to designate yourself as a non-practicing. And secondly, there is a defamation process, and this you will find it in the guidance document. Council does allow you to apply, and the defamation will be discussed at the CPD committee, and they will consider your reasons for requiring defamation, and they will take it to a council meeting for further discussion and ratification. So depending on what the outcome is, defamations are not to be approved for more than 12 months. So if council is to grant you a deferment, it will not exceed the 12 months. And then the last question was, when are CPDs due? CPDs are due on the 31st of December of each year, but council does provide you with a grace period, which then ends on the 30th of April of the subsequent year. I'm going to end the presentation here and open for questions and discussions, suggestions.
Raisibe. Hello, Raisibe.
Hello? Hello, can you hear me?
Yes, we can hear you very well.
Okay, thank you. My name
Sorry about that. Before we start with the discussion session, sorry to meet you, sir. I just want to introduce Mrs. Mojo Mokwena, who is our newly appointed COO. She has honored us by joining us tonight. So she is here and she will be assisting us with answering the questions as well. Thank you very much, Mrs. Mokwena. Sir, please go ahead, unmute yourself and then ask your question.
Thank you. I'm Vuga Buthelezi. I'm a retired pharmacist. And initially, I thought I wasn't going to be practicing as such, but I have been roped in an organization that one can liken it to an old age home where medicines are prescribed by a doctor and then dispensed by a pharmacy and then kept by this old age home. Now I've been roped in to come and look after those medicines which have been dispensed and everything complied with. So now I'm not so sure whether I need to register or not because I missed the annual declaration and therefore I haven't designated myself. How can I do that? Thank you.
You missed the annual declaration for which year? For 2020 or for 2021?
For 2020 already. I inquired last year and I never got an answer from council.
All right. Firstly, I'm not sure if you were with us in the presentation when we went through the frequently asked questions and the facts. But from what I'm understanding, you are practicing there as a pharmacist, and as a result, you are practicing. But what we have done to everyone who did not complete their annual declarations for 2020, we have designated you as a practicing pharmacist. You then need to log in on the SAPC website, go to the CPD system, complete the annual declaration for 2021, and make sure that you comply with the CPD requirements for 2020 and for 2021. So for 2020, it should be done by the 30th of April, which is 10 days from now. And then for 2021, it has to be done by the 31st of December.
Okay, all right, thank you.
Thank you, sir. Mr. Andrew, I see your hand is up. Please ask your question. All right. We will also go through the questions in the chat box. There is a comment in the chat box that is saying a step-by-step tutorial on how to submit the two-step CPD entry in 6 minutes is available on our YouTube channel. And they put in a link there where you find a live example of us doing that. We also have a live example of the 4-step CPD entry, which is done in 13 minutes. It's also there. And then there is a question that is saying, I am on radio once a day, every week, telling the public about common diseases. I read up on this before every show. Can I use this as CPD? Londa, yes, you can. I actually hope that your question was answered during the presentation. If you are extremely busy during the year, do you need to submit CPDs on a bi-monthly? I did all 6 activities last year in December, as that was a slower period. Can all 6 be submitted in 1 month? Yes, they can. The one CPD bi-monthly was an example that I was using in order for a person to be able to calculate their prorata. If for some reason they feel they should not have been mandated to comply with the requirements for the whole year. If a person was non-practicing or they only started being registered as a pharmacist on a different month. There is a question from Facebook that is asking, what are the chances of CPD results coming before the 30th of April? Mr. Vadimeja, I have a feeling that this one is an intern, and I opt not to answer this question. And there is one that is saying, if I am a registered student for PCDT, should I still comply with the CPD requirements? And I did explain that if you have registered for a course and you feel that you have learned things there, please log in on the CPD system and complete the CPD steps because you have actually learned. Davina, please unmute yourself.
Yes, I'm just using my daughter's phone. It appears like Davina. Actually, it's not Davina. It's Mr. Olivier speaking.
Yes, sir. Please ask.
I just want to find that we have 4 steps to complete a CPD, and we have 2 steps. So, are you leaving it open to us to choose which one we're going to use, or how does it work? I'm trying to understand in more details the 4 steps versus the 2 steps.
We are leaving it up to you, sir. So you decide which steps to use, but we have limited the 2-step cycle to only 3 activities per year. But you choose which cycle you would like to use.
So, which means if I choose the 2 steps, I will only need to submit at 3 CPDs per year. Is that correct?
No, you need to submit 6, but you can submit 3 using the 2-step. If you select to complete your 3 CPD entries using the 2-step cycle, you will then need to complete the other 3 using the 4-step cycle.
Okay. Now it's clear. Okay.
Thank you, sir. Mamka, I see you have your hand up.
Thank you, Raisibe. I notice, and good evening, colleagues. I noticed that we are losing some members, and I do understand it's been a long day, but I thought that it would be an injustice if I don't say thank you. If I don't say thank you to everyone who took their time this evening to come and listen with us and learn, because we learn every day. I've learned so much about this COVID ever since the vaccines and the condition is here. So I've managed to submit around 4 CPDs on COVID alone. So we can learn, everyone can learn on a daily basis. I am also humbled not only by the people that have joined us through Facebook. I'm looking at the numbers. I think for us from the office is to reach as many people as possible. And it is inspiring when we put platforms like this and we got this much support, because you're dealing with 12 pharmacists with queries that come from 60 million people, because we are the only pharmacy council in the country. So, and we need to serve the people besides the other things that we do. So we thank you for spending this evening with us. I thought maybe let me just say something, because I was watching your numbers, Raisibe. At some stage you have 65 members, you're sitting at 54 at the moment, and people are, I think they want to go and rest. So thank you so much. We get in there. The last time we got the report from communication, we are on 49% compliance. That is good. It's very good. And with the numbers that we see that people are accessing through YouTube, we have 800 so far. We have already had 1,905, I think, from communication that have booked to be with us. We are continuing tomorrow and on Thursday, and we are hoping that by the time we finished here, we would have answered majority of the questions. When I listen to Raisive speaking, I think if you can download these YouTube videos or follow whatever that we have saved on Facebook, you will get most of the answers for the questions that we are asking. So, and let's continue being proud pharmacists out there and serve this country and raise the flag for pharmacy very high. And on that note, I wanted to say thank you before the 54 start disappearing. We really appreciate it. It's really appreciated. Thanks, Raisibe. That's all I wanted to say.
Thank you, ma'am. Omgan, is your hand still up? I hear there's someone who unmuted themselves, but...
Oh, sorry. And I just wanted to say congratulations to Ms. Mukwena for her appointment. Thank you.
There's a question in the chat.
Okay, let me see. When we are in corporate, we are busy with continuous training via our companies. I assume this can be used for CPD points. I thought I just said no CPD points, but it's okay. E.g. GCP training, GDP training, self-development. The courses that you are doing, whatever you are learning where you are, you can use it as evidence, and you can use that for your CPD activities. But no points. You will need to go through the system, go through the cycles, and enter your CPD activities yourself. Thank you. Mr. Berry, please ask your question.
Yes, I don't know if I missed it or lost communication, but there was a question on whether information and brochures and booklets supplied by representatives that visit the pharmacies that have got information that pertains to learning on new drugs, etc. Is that acceptable as we're not talking CPD points, but to submit? Because a lot of these articles are actually written by distinguished authors. If you go into the accolades that are given to these articles, are we permitted to use those? Thank you.
Yes, sir, you can use those.
Thank you.
Are there any further questions? Something to discuss, suggestions? In the absence of further questions and discussions.
Good evening.
Good evening, sir.
How many times can you use a competency in a domain?
You can use it as much as you like. You would have possibly learned different things in that competency and possibly be having different titles. So it is okay. You can use it as much as you have learned.
Okay, thank you.
Thank you. So the slide that I've displayed now, it is showing the resources that the SAPC has in order for you to acquire information. We do have the CPD blog. It is available on the website. You can use that link or go to the website and check where it says CPD blog. That's where we have put in more of the information. And we have also put videos on YouTube. And we are available if you would like to ask further questions on email. Our email address being cpd2020@sapc.za.org. And we also have a social media handle on all social media platforms at official SAPC. That is also where we put in information there for you to learn from. Thank you very much. We really do not take it lightly that you availed yourself for this session. We appreciate you. Thank you.
Thank you.
Bye.